Hey guys, Paulski here, back with another video. So today I want to run through a stretch for the TFL or Tensor Fasciae Latae. So before we do the stretch, I just want to cover off some basic anatomy so we know the muscle that we're trying to stretch. So your TFL sort of runs down the side of your leg near your hip. So it's basically the jeans pocket muscle. So you can think of it where your jeans pocket runs just down here, sort of at the front of the hip. That is your TFL. So if you want to find your TFL, just take your thumb, go into your side, travel up till you find the bony protuberance of the hip bone. So that's your iliac crest. So then you want to walk your thumb down, your iliac crest, and then you're going to find part where the bone just drops off flat, and right on the edge there's like a little knoll. So that's called your anterior superior iliac spine, or ASIS, ASIS for short. So that little bony knoll is where the TFL starts. Then your TFL travels back 1/3 of the iliac crest roughly. So you can put your index finger on the ASIS and then your thumb maybe 2-3 inches back. That's kind of where your TFL goes, and you notice that's just where your jeans pocket kind of is. And then the TFL drops down and kind of joins in to your ITB, or iliotibial band, sometimes called iliotibial tract. So that's where the attachments are for the TFL muscle. So it's also important to note that the TFL is a muscle, right? So it has muscle fibers, whereas the ITB, the iliotibial band or tract, is not a muscle. So the ITB is made out of collagenous fibers, so it's predominantly collagen, which means it's very strong and very elastic, but it's like a spring. So it wants to stretch and then quickly snap back to where it was. It doesn't want to be lengthened. It's more like it acts like a spring, almost like a shock absorber. You can think of it that way. Whereas your TFL is actually a muscle. So your TFL is going to respond a lot better to lengthening and staying lengthened than this ITB is. So a lot of people want to foam roll their ITB, stretch out their ITB. It's debatable whether that's even possible. There's been studies done that say that the amount of load you need to bring to bear on that ITB to actually lengthen it is basically out of the realm of possibility of a human to render that load. You know, that's what one study that I've read has said. So you're probably better off focusing more of your attention on releasing this TFL rather than the ITB, because that muscle is going to be a lot easier to release and stretch than this ITB. So if you're a runner and you're getting knee pain, you feel like it's really tight down the side here, see if it's tender in this jeans pocket region, dig your thumb in, have a look around there. If it's tender, you've probably got some trigger points or knots in there that need to be released, and that this muscle does respond really well to stretching as well, which is what we're going to cover off today. So now we've kind of talked about the anatomy of the TFL. So before we get into the stretch, I want to talk about the function of the TFL, because it's good to know what the muscle does, and that way we can come up with a stretch that is most targeted towards elongating that muscle. So the functions of TFL are to flex the hip. It's a hip flexor, wants to do these ones. Bring the thigh closer to the torso, so that's hip flexion. It wants to do abduction, so it wants to bring the hip away from midline, that's abduction. And it also wants to do internal rotation of the hip, or medial rotation. So we've got our hip, internal medial rotation, external lateral rotation. So TFL wants to go rotating in towards midline. So those are the three functions of TFL. That's going to inform how to do this stretch a little bit better. So now let's talk about the stretch for the TFL. So you know, on this channel, while I love static stretching, I also want to incorporate some sort of little body hacks into our stretching, like PNF style stretches. So whether that be reciprocal inhibition, whether that be contract relax, whether that be an MET, are those PNF style stretches. So we're going to cover off how to stretch TFL today and how to incorporate some PNF style elements in there too. So with that in mind, let's get into the stretch. So I'm all about stretches you can hold comfortably for a long period of time. So this one is one that's really easy to sit into for a long period. We're just going to need a wall. So let's say I want to stretch my TFL on my left-hand side, closest to the wall. So remember, it's that jeans pocket region coming down from the hip at the front. That's the one I want to stretch. So I found my wall. I want to place my hand on the wall, roughly arm's length. My wrist is bent though, so I'm coming in a bit. So about one arm away from the wall. So then remember that the TFL wants to do hip flexion. So I'm going to want to do the opposite. I'm going to want to take it into hip extension. Hip extension is extending the thigh behind the body. So you don't want to do, this is not hip extension because my hip is not extending. You don't want to lean forward, you want to keep body straight. That's hip extension. So we want to do a bit of that. The first thing I want to do, bring my leg behind me slightly. So I've got my leg in a bit of hip extension there. So the next thing I want to focus on is what my hips are doing, going back and forth. So remembering that the TFL wants to do abduction. So the TFL wants to take this left leg towards the wall. That would be abduction. So for stretching it, I want to do the opposite. I want to take it into adduction. I want to adduct it or bring it towards the midline. So I'm just going to shuffle forward a bit. So I want to bring this left leg towards the camera. So it's behind me, but it's coming closer now. So it's towards the camera. So you should already start to feel a light stretch through the hip on that wall side. So that is getting a little bit more of a stretch. So then the other function of TFL we talked about is internal versus external rotation. So the TFL wants to do internal rotation. So for the stretch, I want to do a little bit of external rotation. So in the case of my left leg, this wall leg, internal rotation is rotating towards the camera. External rotation is rotating towards the wall. So I want to take this left leg and rotate the whole leg just a little bit towards the wall. Try not to turn your hips. Keep your hips roughly square with the camera if you can. I've rotated that left leg a little bit in towards the wall, just a little bit. And it's going to depend, if you struggle with internal rotation, you're not going to be able to get much external. A lot of people are limited there, but this is going to help with that a little bit. So now we've talked about covering the three functions of what TFL does. You also know that on this channel, I like to do a bit of PNF style stretching. So what I'm going to do to get the static stretch, I'm going to lean my hip towards the wall. So my hip's dropping this way directly towards the wall, but I also want to go a little bit forward. So I'm pushing my hips forward, or letting them fall forward with gravity actually is a better way to explain it. And I'm leaning my hip towards the wall. So my hip's just dropping into the wall. I'm already starting to feel the stretch through that left jeans pocket area. So now my TFL is stretching. So I can actually hold that for a considerable period of time. I'm just leaning on the wall, my arms straight, so I'm not really using much effort to do this. And play with the angle a little bit. So if you want to push your hips a little bit more forward, for me, I'm feeling that more in my TFL. It's almost like I'm going diagonal with this stretch, and then I'm really starting to feel the TFL. So if I want to do PNF style stretching, after I sat into this, I'm going to push. So I'm going to push my hip towards the camera, but it's also going to come a little bit back. But I can also twist my torso by pushing with my TFL back and around this way. So that's going to be a bit of, I'm using reciprocal inhibition as well as a bit of contract relax. I'm using contract relax by doing what's internal rotation almost, but I'm also pushing my hip towards the camera, and that's going to start abducting the hip. And then once I've just done that, so I push towards the camera and turn it this way a little bit. You feel your TFL contract. Hold that as on an in-breath, so breathe in 6, 8 heartbeats, and then let it drop into the wall again, and you'll feel that it's let go a bit. And then now I'm just dropping and relaxing the gravity. So now I'm letting the hip drop into the wall this way and forward a bit. And now I'm really feeling that TFL stretch. So then I'm going to do another sort of PNF set, so then I can push away from the wall with my hip. I can even squeeze that TFL, bring it in around this way. I'm pushing with my TFL, so I'm contracting my TFL, pushing the hip towards the camera. 6 to 8 heartbeats. As I breathe in. And breathe out. Let it go. Leaning in towards the wall. And really letting that hip come forward and hips dropping towards the wall. And I can really feel that. If you need a little bit more external rotation of that leg, should be able to get a little bit more now. So I'm rotating that leg towards the wall a little bit. External rotation, I should say, as I drop into it. So then I'm going to do another in-breath. I'm going to push away from the wall. I'm going to turn with my TFL back that way. Breathe in. And as I breathe out, let it drop. So now my hips are going towards the wall, slightly forward. And I'm just going to hang here. And really let that TFL elongate. So this last one, just going to hold as long as it takes for that. So really feel a good lengthening and release. So with your static stretches, it's not about time, it's not about 30 seconds, 60 seconds. Remember, your body doesn't know it's Monday, your body doesn't know about seconds and days and months. All your body knows about is breaths and heartbeats. So work with your breath, nice long in-breaths, longer out-breaths, and just wait until that muscle really feels like it stopped struggling, it stopped pulling, and it just feels like it can stay comfortably lengthened. That's how long you want to hold it for. So I'm just going to gently come out of that. Oh my, I can feel all that jeans pocket region just through here in front of this hip is nice and loose now. So there you have it, guys. That is the stretch for TFL, incorporating a bit of static stretching as well as some PNF stretching. I hope that one helps you, especially you runners out there or guys who do a lot of martial arts or anything with a lot of hip flexion. Dancers is another one who get quite tight through the TFL. This is going to be a great one for you to incorporate into your stretching program. So we're going to leave it there today, guys. Thanks for tuning in. We'll be back real soon with another video, and remember, listen to your body and breathe.